So unless you've lived alone in the Arctic for the last 35 years, you know already that October is National Breast Cancer Awareness Month. You know, pink, 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 1 in 8, get your mammogram. Most of us in the public have already heard all of this. So today in the recovery room, I am going to share 25 facts that even seasoned breast cancer survivors may not know. I'm cancer physical therapy specialist, Dr. Leslie Welke. Welcome to the recovery room. Please share this video and let me know in the comments section how many of these breast cancer awareness truths you were not aware of or surprised you. Number 1, National Breast Cancer Awareness Month was founded in 1985 by the American Cancer Society and Imperial Chemical Industries, now part of AstraZeneca. Number 2, though many people do find their own breast cancers, monthly self-breast exams as a screening tool are not effective. As reported by the National Breast Cancer Coalition, evidence shows that breast self-exams do not save lives or detect breast cancer at an earlier stage. The American Cancer Society is phasing out breast self-exam materials, the National Cancer Institute has stopped printing breast self-exam guides, and the U.S. Preventative Services Task Force recommends against healthcare providers teaching self-breast examination. Women and men, however, should have a good idea of what their breasts normally feel like, so if they note any change, they can alert their physician. Number 3, 2 of the biggest risk factors for getting breast cancer are being female and getting older. The risk of cancer goes up with age, not down. Most breast cancers are found in women age 55 and older. Number 4, I know you know this. Men have breasts, so you should too also know that men can get breast cancer. A man's lifetime risk of breast cancer is about 1 in 883. In the US in 2020, about 2,620 men will be diagnosed with breast cancer, and 520 men will die from breast cancer. Number 5, yes, smoking cigarettes is linked with breast cancer. Younger women who smoke have a higher risk of breast cancer compared to those who don't. Number 6, no, deodorants and antiperspirants do not cause breast cancer. The American Cancer Society, the Food and Drug Administration, accredited cancer centers, and even the Cosmetic, Toiletry, and Fragrance Association confirm this. Number 7, the earliest historical mention of any type of cancer is a case of breast cancer, which was documented in Egypt in approximately 1600 BC. Number 8, all humans have the BRCA1 and BRCA2 genes. Some people have the mutation in their BRCA1 or 2 genes that puts them at risk of developing breast cancer or other cancers. BRCA mutations are rare in the general population at just under 1%. Number 9, the BRCA gene mutation can only be inherited from a parent who also has the mutation. Both men and women can carry and pass along the BRCA1 and 2 mutations. Number 10, no, nipple piercings do not cause breast cancer. Number 11, no, women with large breasts are not at higher risk of developing breast cancer. Number 12, no, breast implants do not cause breast cancer. Number 13, no, carrying your cell phone in your bra does not cause breast cancer. Number 14, no, there is no evidence that sugar in the diet causes breast cancer. Cellular glucose and dietary sugar are 2 different things. Being overweight or obese, however, is linked to some breast cancers. Number 15, according to the American Cancer Society, breast cancer death rates have been relatively unchanged in women under 50 since 2007, but have dropped in women over 50. The overall death rate from breast cancer decreased about 1.3% per year from 2013 to 2017. Number 16, when people think second opinions, they typically think about second opinions on their treatment plan. However, newly diagnosed people can get a second opinion on their pathology report and type of cancer. Talk to your cancer doctors, as many cancer centers do this automatically. This is really important because if the type of breast cancer is not diagnosed accurately, then the type of treatment may not be developed accurately. Number 17, mastectomies began being performed in the 1880s and lumpectomies in the 1970s. By 1985, research found that survival rates of a lumpectomy followed by radiation were equal to that of a mastectomy. Number 18. Though clinical trials are a critical driver of how to treat breast cancer, less than 3% of adult cancer patients participate in clinical trials. Number 19. Exercise is critical to cancer survivors. However, studies suggest that only 17 to 30% of cancer survivors meet recommended activity levels. For breast cancer survivors, exercising 150 minutes per week has been shown to decrease the risk of breast cancer recurrence and the risk of dying from breast cancer. Number 20. About 85% of breast cancers occur in women with no family history of breast cancer. Number 21. As of January 2020, there were more than 3.8 million breast cancer survivors just in the US. Number 22. When I began working in cancer care in the 1990s, stage 4 metastatic breast cancer was incurable. Number 23. 30 years later, in 2020, stage 4 metastatic breast cancer remains incurable. Number 24. On average, only a small part of cancer funding and research goes towards stage 4 metastatic breast cancer. Number 25. The breast cancer ribbon is pink. However, breast cancer is not. Like all cancers, it remains an ugly, horrible disease that can leave physical, psychological, and emotional scars. So as we wrap up Breast Cancer Awareness Month, here is a huge shout out to all breast cancer survivors across the planet, especially to the 150,000 in the US living with stage 4 disease. Cancer sucks. Learn from each other, support each other, care for yourself well, and exercise like your life depends on it. I'm Dr. Leslie Walke. Thank you for joining me in the recovery room. Remember to share and let me know if any of these facts were surprising to you. Let's talk again soon.